We always try to curate a collection of information, really tailored for you, our listener, so we can help you become well-informed on complex topics without feeling totally overwhelmed.
That's right.
And today, well, I think it's safe to say, today we are venturing into a topic that touches all of us in one way or another: self-diagnosis.
Absolutely. And we have a very interesting set of sources for
Dive
this. I
as
mean,
deep
we're
dive.
looking at a lot of Dr. Maya's work on self-diagnosis,
Right.
her books, the tools she's created, and then we're going to be looking at some pretty deep philosophical explorations. We'll be looking at Vivekananda's Maya and Illusion,
I love it. Yeah.
as well as kind of more public health perspectives on understanding health and even some philosophical texts on Maya. So a lot to cover.
Yeah, it is a fascinating combination because when you think about it, self-diagnosis seems like it's all about practical health decisions. Do I have this? Do I need to go to the doctor? What should I do about this? But then as we delve deeper, we'll see that it really connects to some really fundamental questions about how we understand our own bodies.
Yeah.
And even how we perceive reality itself, thanks to this concept of Maya, which is something we'll unpack.
Yeah,
I think there are definitely some intriguing overlaps and complexities to explore.
there are.
So our mission today is to really unpack this, to understand when self-diagnosis can be helpful, where the real dangers lie,
Yes.
why expert medical advice from qualified professionals remains absolutely vital,
Right.
and even to just sort of step back and consider how our own perception might shape our actual experience of illness.
Yeah, it's a big topic, a very big topic.
It is. It is. So why don't we start with, I guess, sort of a foundational point that Dr. Maya makes very clear right at the beginning of Art of Self-Diagnosis Vol. 1,
Okay.
which is her book, and that is a very strong disclaimer,
Uh-huh.
emphasizing that this information should not be taken as medical advice. The book very clearly stresses that qualified healthcare professionals, these are the people with the training
Yes.
and the experience to provide accurate diagnoses and effective treatment plans. They're drawing upon years of study and practice, not just following some kind of standardized checklist.
That's right. That's an absolutely crucial point to make. And I think it's one that, people maybe don't always appreciate until they've maybe been through the system themselves.
Right.
It's easy to think that, oh, well, you just follow this protocol and you should get the right answer. But it's far more nuanced than that.
Yeah, it's not a simple recipe book
Yeah.
kind of approach to health.
No, it's not. And the book specifically cautions against, individuals like nurses or chemists, for example,
Okay.
attempting to diagnose or treat conditions without that comprehensive medical background.
Right. So even someone with a lot of knowledge about health,
Yeah.
it's not the same as having gone through medical school and having that training as a physician.
Absolutely.
However, the book also states that its goal is to help people understand their bodies better,
Yeah.
identify potential wrongdoings that could lead to health issues, and ultimately empower them to seek the truth about their own well-being. So it really sounds like it's more about informed self-awareness
Yes.
to guide conversations with healthcare providers.
Yes, that's a great way of putting it. It's about empowering individuals to take ownership of their health and to be active participants in their own care, to have informed discussions with their doctors rather than just passively accepting whatever they're told.
Yeah, I like that.
And Dr. Maya's perspective is further illuminated in the foreword by her colleague Srivatsa.
Okay.
And he really frames her work around the critical issues of preventing infections, reducing the inappropriate use of antibiotics, which we'll be touching on later, and tackling the ever-growing problem of antibiotic resistance.
Yeah. What really strikes me from Srivatsa's contribution is his own personal experience back in 1989 with a life-threatening MRSA infection in a young person.
Yes.
And he describes this event as profoundly impactful, really underscoring the urgency of the fight against drug-resistant bacteria.
Mm-hmm.
When you hear a story like that, it just kind of brings it home.
It does. It makes it very real.
Yeah. And this experience, we learn, is actually what spurred his work on the pediatric assessment tool, PT,
Yeah.
which is designed to help junior doctors differentiate between common and more severe illnesses in children.
Yes. So a tool aimed at supporting medical professionals in making those accurate assessments,
Right. It's interesting because in the book, there's this real consistent emphasis on the absolutely vital role of primary care physicians.
Yeah.
The book really highlights their extensive training, the breadth of their expertise,
Mm-hmm.
and their ability to provide truly personalized care,
Yes.
that considers the individual's complete health picture over time.
Absolutely. They're not just looking at a snapshot in time. They're looking at your whole medical history, your lifestyle, your family history, all these factors that can influence your health.
Yeah, it's that holistic approach
Yeah.
that I think people really value.
Yeah.
Now, the book does present, a somewhat critical view of healthcare systems
Okay.
where non-physician professionals might be taking on diagnostic and management roles.
Right.
It raises concerns about the potential for errors when standardized protocols are followed
Yeah.
without, that depth of understanding that a physician brings.
Right.
It even cites a claim
Okay.
about high medical error rates being a significant cause of mortality in such context.
It's a controversial area, but it's definitely a point worth considering. I mean,
Hmm.
we have to ask ourselves, are we striking the right balance between, providing efficient healthcare and ensuring that patients are getting the most accurate diagnoses and treatment plans?
Yeah, it's a really important question.
Yeah.
And then the book outlines, a number of steps that individuals can take to better understand their own symptoms.
Okay.
So, things like noting when those symptoms started, how often they occur, how severe they are.
Yeah.
Basic things, but really important things.
Yeah. Just really being mindful and aware of what your body's telling you.
Exactly.
It also recommends gathering a thorough personal medical history,
Uh-huh.
even performing basic self-checks.
Okay.
Things like taking your temperature. But the crucial point is, after doing all that, is always to then consult with a primary care physician.
Absolutely.
Don't just try to figure it out on your own.
Yeah. It's great to be proactive and to gather as much information as you can.
Yeah.
But ultimately, you need that expert medical guidance to really understand what's going on and to get the appropriate treatment.
Yeah. And that's where I think the potential dangers of relying solely on online information for self-diagnosis.
Really become clear. The book talks about the slippery slope of getting lost in internet searches,
Yeah.
potentially causing unnecessary anxiety by relating to every symptom you read about.
I think we've all been there.
Oh, absolutely. We've all done it.
You start Googling your symptoms and suddenly you're convinced you have some rare, life-threatening disease.
Yes, exactly.
It
It can be a real rabbit hole.
And, even more importantly, it warns against individuals without medical training attempting to diagnose and treat themselves
Right.
based on these, online protocols, bypassing the essential step of a doctor's evaluation.
Yeah, that's where things get really dangerous.
Yeah.
There's a lot of misinformation out there,
Right.
and people can easily misinterpret what they're reading or self-prescribe medications that could actually be harmful.
Yeah, and it's interesting. There's even mention of a study in the book suggesting a surprisingly high rate of diagnostic and treatment errors, even among primary care professionals in some settings.
Oh, really? Around 82%, which is a really concerning figure.
That is quite concerning.
Yeah.
And it just
So that's why when we got this collection of stuff on Maya, well, it really piqued our interest. And we're not talking ancient civilizations here.
No, this is something entirely different.
Right. It's all about self-diagnosis, how we can understand our own health better. And it even involves this app, Dr. Maya, and this Dr. Maya GPT.
And looking at what we've got here, it's pretty expensive. We've got excerpts from Art of Self-Diagnosis Vol. 1. There's a whole book, Maya Bring Tears of Happiness.
Wow.
Then there's information on this Dr. Srivatsa legacy and a guide called The Self-Diagnosis Solution. It seems like we're going way beyond just a simple symptom checker with this Maya thing.
It does, doesn't it? So we're diving deep today into Maya. We want to figure out what it is, why it's important now, how it came about, and all the big ideas behind it. Things like education, prevention, and even this whole symbiotic global health thing.
Sounds like a plan.
So first things first, what exactly is this Maya?
Well, from what I'm seeing here, it's like a two-pronged approach. You've got the concept of self-diagnosis, and then you have the tool, the Dr. Maya app. Art of Self-Diagnosis really emphasizes empowering people to understand their health, like really understand it.
So it's not just reacting when you get sick.
Exactly. It's about being proactive,
Right.
paying attention to what your body's telling you.
Okay, that makes sense.
Mm.
And the app itself seems to have this really unique system. Color-coded symptoms and an algorithm. That's a step up from just a list of possible illnesses, right?
Definitely. Picture this. You put in 3 symptoms, each with its color code. The app takes that information and helps you see the bigger picture. What could be going on and what should you do next? It's about getting a more reliable assessment without getting lost in that sea of internet health advice.
That's reassuring. Now, there's also this Dr. Maya GPT. The Dr. Srivatsa legacy document suggests it's related, but it seems more focused on the large-scale stuff like pandemics.
Yeah, it's interesting, right? The core idea of symptom categorization is there, but it's applied differently. Think about it. Dr. Maya GPT could help track the spread of infectious diseases, even across entire regions.
Wow,
Imagine the potential for allocating resources and managing outbreaks.
that could be
Yeah.
huge. And the color coding system seems to be a common thread here. Dr. Srivatsa legacy says red means you need to see a doctor or go to the hospital ASAP.
Right, serious stuff.
And green and yellow mean maybe a pharmacist or self-care is enough. It's like a built-in triage system, both for individuals and for public health.
I see what you mean. So this all sounds pretty impressive, but why is it so important right now? Why all the focus on Maya at this particular moment?
Well, one thing that jumped out at me from Art of Self-Diagnosis was this whole issue of online health information overload.
Oh, yeah, information overload for sure.
More and more people are going to their doctors worried because of something they saw online.
And that just adds to the anxiety, doesn't it?
It absolutely does.
Yeah.
The source even mentions a study that found only a small percentage of health information on social media is actually helpful.
That's a scary thought.
So Dr. Maya, with its curated approach, could be a much-needed antidote to that unreliable information out there.
Like a filter, cutting through all the noise.
Exactly. It also challenges this idea that self-diagnosis is only for minor stuff.
Oh, yeah, that's a common misconception.
The book actually says Dr. Maya can help you understand symptoms that could indicate a serious problem.
But, and this is a big but, it's crucial to remember that it's not a replacement for professional medical advice,
Right, it's about being informed, not about avoiding doctors altogether.
especially if you have something serious going on. Now, shifting gears to Dr. Maya GPT, the Dr. Srivatsa legacy document really highlights its potential for, well, think back to the COVID-19 pandemic.
The strain on hospitals, the pressure on healthcare workers.
Exactly. Dr. Maya GPT could help with early detection of infectious symptoms. They even use the color blue for that. Early identification means quicker action, things like self-isolation, which can slow down transmission.
It's almost like an early warning system, both for individuals and for public health.
Right. Imagine real-time monitoring of symptoms on a large scale. That data could provide early alerts about potential outbreaks,
And with those alerts, authorities could be more targeted in their response.
potentially avoiding those widespread lockdowns that disrupt everything.
And the whole philosophy behind Dr. Maya seems to be about putting the patient first.
Absolutely. Patient-centric care.
Dr. Srivatsa legacy contrasts this with the traditional doctor-centered model. Dr. Maya, accessible through smartphones or basic internet, could overcome a lot of barriers to healthcare.
It's about reaching people regardless of where they live, their income, or even language barriers.
And think about the potential cost savings. If people are empowered to manage minor things at home, and if serious cases are triaged more effectively, we could see fewer unnecessary doctor visits, fewer hospitalizations.
Potentially even fewer expensive tests.
Right, and that could make universal healthcare more affordable and accessible for everyone.
And don't forget the economic side of things. Early identification and isolation during pandemics could prevent massive economic losses from widespread illness.
It all boils down to scalability and accessibility, doesn't it?
Yeah.
The Dr. Srivatsa legacy source points out that Dr. Maya doesn't require building tons of new infrastructure,
That makes it a viable option pretty much anywhere.
and it really puts you, the individual, in control.
You're not passively receiving information. You're actively engaging with your health, understanding your body's signals.
It's about self-awareness and self-advocacy.
And when you empower individuals like that, you also end up protecting essential workers.
Because by helping to contain outbreaks, you're safeguarding the health of everyone, especially those on the front lines.
And given the growing threats of pandemics and antibiotic resistance, well, as the Dr. Srivatsa legacy document puts it, adopting systems like Dr. Maya is becoming increasingly urgent.
It's about building resilience and preparedness for future health crises. So we're getting a pretty good grasp on what Maya is and why it's important now, but who's the brain behind it all?
That would be Dr. Srivatsa. He seems to be a doctor dedicated to, well, empowering individuals in their healthcare journey.
A real advocate for patient empowerment.
Both Art of Self-Diagnosis and Maya Bring Tears of Happiness really highlight that. And what's fascinating is that this isn't a new thing for him. Apparently, he developed something called PETI, a pediatric assessment tool, way back in 1985.
1985.
Yeah, that was one of the earliest examples of using AI in medical diagnosis. He's been thinking about this for decades.
It really shows his depth of understanding when it comes to the complexity of this stuff.
Absolutely. And his core belief seems to be helping people overcome that fear of self-diagnosis.
Giving them the tools to do it responsibly.
Dr. Srivatsa legacy describes him as a visionary physician with over 40 years of experience fighting infections and working to prevent global health crises.
40 years. That's incredible.
It's no wonder he's so passionate about this.
And that experience has led him to identify some pretty big problems in healthcare. Things like delayed detection of infections, overuse of antibiotics, and a lack of public awareness about health.
It's like he's trying to address those gaps with Dr. Maya.
It's a solution-oriented approach.
It's interesting, too, Art of Self-Diagnosis mentions his critique of over-reliance on evidence-based medicine.
Oh, tell me more about that.
Well, he argues that too much focus on statistics can sometimes stifle a doctor's clinical judgment, their ability to think independently about each patient.
So it's not about ignoring the evidence, it's about finding the right balance.
Right, and this ties in directly with the problem of antibiotic resistance. He stresses the importance of preventing infections in the first place, so we don't need antibiotics as often.
Proactive rather than reactive.
Precisely. It seems like Dr. Maya is his response to what he sees as limitations in our traditional healthcare systems.
Like he's trying to create a new paradigm, a more proactive, preventative, patient-centered approach.
Exactly. Now, here's where things get really interesting. Maya Bring Tears of Happiness introduces this idea of live and let live when it comes to microbes.
Instead of constantly trying to wipe them out.
It's about accepting that we exist in a symbiotic relationship with this unseen world.
So it's not just about fighting germs all the time.
It's about finding a balance.
Mm-hmm.
And there's real science behind this. Art of Self-Diagnosis talks about the gut microbiota.
Our gut microbiome.
It plays such a crucial role in our overall health, everything from our immune system to producing essential compounds.
Wow, I didn't realize it was so important.
And antibiotics, while life-saving at times, can disrupt that delicate balance.
So they can do more harm than good sometimes.
Well, they can have unintended consequences. They don't just kill the bad bacteria, they can also kill the good ones. And that can lead to all sorts of health problems, not to mention antibiotic-resistant bacteria.
That's a worrying thought.
And it's not just antibiotics. The sources also raise concerns about biocides, those chemicals in disinfectants and hand sanitizers.
Those things can be harmful too.
Well, they can have a negative impact on aquatic life and soil organisms, and even on our own health through prolonged exposure. And there's a chance they could lead to biocide-resistant microorganisms.
That's unsettling.
It really highlights this interconnectedness between our health and the health of our environment. Art of Self-Diagnosis even mentions the One Health concept, this idea that human, animal, and environmental health are all linked, especially when it comes to antimicrobial resistance.
So it's not just about us, it's about the whole ecosystem.
Exactly. It seems like our attempts to eliminate microbes might actually be backfiring. We're disrupting the natural balance, and that could have unforeseen consequences.
So instead of waging war on germs, we need to learn to coexist with them.
Find that harmony, that balance. Now, this brings us to the final piece of the puzzle. Why does Dr. Maya GPT emphasize education, prevention, and reducing healthcare disparities so much? And what's this about Isaac Newton's prediction?
It's almost like a call to action.
It is, isn't it? The emphasis on education seems pretty clear-cut. Both Art of Self-Diagnosis and the Self-Diagnosis Solution talk about empowering individuals with knowledge.
So they can make informed decisions about their health.
And know when to seek professional help. Prevention is also a big part of Dr. Maya's philosophy.
Preventing problems before they start.
Exactly. Art of Self-Diagnosis stresses that focusing on prevention can improve overall well-being and reduce the strain on healthcare systems.
It's a proactive approach to healthcare.
And then we have the crucial issue of healthcare disparities.
Making sure everyone has access to quality healthcare.
Dr. Srivatsa legacy really highlights this. Dr. Maya GPT, with its accessibility and intuitive design, could address those inequities and create a more level playing field in global health.
And by reducing unnecessary healthcare visits, it could also help to minimize the spread of infections within communities.
which benefits everyone.
Right, it's a win-win. Now, going back to that idea of a symbiotic relationship with microbes, it seems like the argument is that disrupting that balance could have dire consequences.
Potentially even threatening the survival of humanity.
And this mention of Isaac Newton's prediction, while we don't have the specifics, it seems like a warning.
Like a cautionary tale.
Maybe it's a metaphor for a point of no return. If we keep trying to eradicate microbes, we might trigger something catastrophic.
So education, prevention, and reducing disparities aren't just about improving healthcare now.
They're about ensuring a sustainable future for humanity.
A future where we coexist with microbes, not try to destroy them. So to sum it all up, Maya is more than just an app or a GPT model. It's a philosophy, a way of thinking about healthcare.
It's about empowering individuals, about prevention, about finding balance.
And it's about recognizing our interconnectedness with the microbial world.
It's a lot to take in, but it's incredibly thought-provoking.
It really is. And it leaves us with a lot of questions to ponder. Are we at a crossroads, as that reference to Newton suggests?
Can we change course and create a healthier, more sustainable future?
These are questions we all need to be thinking about.
And Dr. Maya, with its innovative approach, could be part of the solution.
I mean,
Yeah.
it's not always a straightforward process.
It isn't. Wait.
And even experienced professionals can make mistakes.
Right. And it really brings us back to, Dr. Free's broader work on raising awareness about the very real threat of superbug pandemics.
Mm-hmm.
And his development of that POT tool, that's really aimed at empowering non-medical individuals to better understand when an infection might be serious,
Right.
with the larger goal of improving self-care practices and, overall health outcomes within communities.
Yeah, I mean, prevention is always better than cure, right?
Absolutely.
So the more we can educate people about how to take care of themselves and how to recognize when something might be serious,
Yeah.
the better off we'll all be.
However, it is important to underscore,
Yes.
as the book itself does, that self-assessment tools and increased awareness are not substitutes for professional medical expertise,
Right.
especially when it comes to serious health conditions.
Absolutely.
Delaying that expert evaluation can have, significant and negative consequences.
It really can. There's a difference between being informed and taking on the role of a doctor.
Yeah. Yeah, absolutely.
It's about knowing your limits.
Yeah.
And seeking professional help when you need it.
I think the COVID-19 pandemic really highlighted the challenges and complexities of diagnoses, on a large scale.
It certainly did.
The book touches on how the initial reliance on fever as a primary symptom could sometimes lead to, misdiagnoses of other, maybe even more serious conditions.
Yeah, I remember that. It was very confusing at the beginning.
It was.
Because fever can be a symptom of so many different things.
It can.
So it wasn't always clear what was COVID and what wasn't.
Yeah, and then there were those well-documented issues with the accuracy of tests. False negatives potentially leading to further spread.
Right.
And false positives causing unnecessary disruption. People having to isolate when they didn't need to.
Yeah, it was a real challenge.
It was.
Yeah.
What's interesting, though, is the book's emphasis on the importance of fundamental clinical knowledge,
Mm-hmm.
a doctor's training and judgment over simply relying on potentially outdated published guidelines or, rigid protocols during, such rapidly evolving situations.
Right. I mean, guidelines are important, but they can't account for every single situation.
Right.
And sometimes you need that clinical judgment, that experience to make the right call.
Exactly.
Yeah.
Exactly. The book also briefly mentions the role of, measures like social distancing in controlling community transmission, but it points out that those strategies, don't directly address other types of diseases.
Right. I mean, they're great for respiratory viruses, but they don't do much for bacterial infections or, other types of illnesses.
Right. Right. Now, there's this potential downside to the very accessibility of self-diagnostic tools, and it's something that the book talks about.
Okay.
This sheer amount of information that they can provide might feel overwhelming.
Yeah.
And could paradoxically delay someone from seeking professional help when it's truly needed.
Yeah.
Potentially allowing a condition to worsen over time.
I can see that happening. It's almost like information overload.
It is. It is.
You get so caught up in researching your symptoms, you forget to actually do something about them.
Yeah. And the book also touches on the possibility of tension arising
Okay.
between patients who come in with a self-diagnosis based on their own research
Uh-huh.
and healthcare providers who need to conduct their own thorough assessment.
I can imagine that can be a tricky situation.
It can be.
On the one hand, it's great that patients are taking an active role in their health.
Yeah.
But on the other hand, doctors are trained to be skeptical and to not just accept a diagnosis at face value.
Right. They need to go through their own process.
Yeah.
The book also clarifies a really key distinction,
Okay.
which is the difference between a symptom like a headache or fatigue
Hmm.
and an actual diagnosed disease like migraine or chronic fatigue syndrome.
Right. And that's an important distinction to make
It is. It is.
because the same symptom can have many different causes.
Absolutely.
Right.
The book even shares a story about a frustrated caller to a health advice line
Oh, really?
who is using the term flu
Oh, okay.
to describe a whole range of specific symptoms they were experiencing,
Right.
illustrating how important it is to be precise when communicating about your health concerns.
Yeah, it's about being specific and using the correct terminology.
Right, right. And the advice to keep a detailed record of your symptoms, noting exactly when they started, how long they last, what makes them better or worse.
Yeah,
That's incredibly valuable.
absolutely. I mean, that kind of information is gold to a doctor.
It is. It is.
It helps them to piece together the puzzle and to make a more accurate diagnosis.
It really helps the doctor piece together what the book calls the story of the illness.
Right.
That narrative then guides their thinking towards a possible diagnosis, which is followed by a physical examination
Uh-huh.
and often further tests
Okay.
to either confirm or rule out their initial hypothesis and determine the appropriate course of treatment. It's a careful, step-by-step process, really relying heavily on the doctor's training and clinical judgment.
Yeah, it's a combination of science and art, really.
It is. It is.
Yeah, you need the scientific knowledge, but you also need the intuition and experience to interpret that knowledge correctly.
And the book does express concern about the increasing use of standardized assessment sheets or computer programs as, kind of the primary method
Okay.
of gathering information, particularly when used by less experienced medical professionals.
Right. I can understand the appeal of those tools. They can be very efficient.
Yeah.
But I think there's a danger of them becoming too impersonal.
Yeah.
You lose that human connection, that ability to really listen to the patient and understand their individual story.
Exactly. It argues that a direct conversation with the patient is essential for building a real understanding of their experience
Yeah,
and establishing a therapeutic relationship.
absolutely.
And that's something that a rigid questionnaire simply can't achieve.
No, it can't.
The book shares a really impactful and frankly tragic story here. It's about a mother who requested antibiotics for her son's sore throat, and the initial doctor suspected a viral infection
Okay.
and declined to prescribe them.
Right.
The mother then sought help at an urgent care center, and there, a nurse did prescribe antibiotics.
Oh.
And tragically, this decision led to the development of antibiotic resistance in the bacteria, resulting in sepsis and the boy's death.
That's awful.
It is a really stark illustration of, the crucial difference between a doctor's training, which emphasizes seeking the underlying cause and understanding potential complications,
Yeah.
versus a more protocol-driven approach.
Yeah. It really highlights the importance of having that deep medical knowledge and the ability to think critically about each individual case.
Yeah. The book really draws a contrast between doctors who are trained to listen, to perform thorough examinations,
Yeah.
and to synthesize complex information to arrive at a diagnosis,
Right.
and nurse prescribers,
Okay.
whose training often focuses on identifying symptoms and following established protocols to issue prescriptions.
Yeah, and I think it's important to acknowledge that both roles are valuable,
Absolutely.
but they require different skill sets.
They do. They do.
And it's important to make sure that people are practicing within their scope of practice
Yeah.
and that patients are getting the level of care that they need.
Yeah.
The book also raises important questions about the potential dangers of rigidly adhering to evidence-based medicine, which is generally a good thing.
Right.
But without always considering the nuances of individual cases and the breadth of a doctor's knowledge and experience.
Right. So it's not just about following the guidelines blindly.
No, it's not. It's about using your judgment
Yeah.
and your experience to make the best decision for each individual patient.
And one of the really thought-provoking points here is the suggestion that relying too heavily on algorithms in diagnosis and treatment
Okay.
could actually stifle independent and creative thinking among medical professionals,
Yeah.
potentially preventing them from considering, maybe less common but ultimately correct diagnoses.
I can see that. It's important to have those tools, but we can't let them replace our own critical thinking skills.
No, absolutely not.
We have to use them as aids, not as substitutes for our own judgment.
Yeah, and this touches on this ongoing discussion within medicine about the balance between strictly evidence-based guideline
Right.
and a doctor's holistic, patient-centered approach.
Yeah. I think it's about finding the right balance.
It is. It is.
Evidence-based medicine is crucial, but so is the doctor-patient relationship.
Absolutely.
And the doctor's intuition and experience.
And despite all the advancements in medical technology, the book strongly emphasizes that the human connection in medicine remains irreplaceable.
Yes, it does.
Technology should serve to enhance doctor-patient relationship, facilitating better communication, information management,
Mm-hmm.
but it should never replace that essential human element of
Yeah.
empathy and understanding in creating, effective and personalized treatment plans.
Absolutely. At the end of the day, medicine is about people.
It is.
It's about caring for people.
Absolute.
And you can't do that effectively without that human connection.
No. The book also touches on the limitations of, those personal self-monitoring devices like blood pressure cuffs or fitness trackers.
Yeah.
While they can be really useful for individuals managing chronic conditions, tracking trends over time,
Right.
they're not designed to be definitive diagnostic tools. No, for new or acute illnesses.
Absolutely. They can provide useful information, but they're not a replacement for a doctor's evaluation.
Yeah, absolutely. And then there's the whole complex area of fever.
Mm-hmm.
And the book explains the difference between a true fever, where the body's internal thermostat is reset, and hyperthermia,
Yeah.
which is simply an overheating of the body. It also mentions the ongoing debate among doctors about what constitutes a normal temperature
Right.
and the sometimes unclear role of fever in diagnosing bacterial infections,
Yeah.
despite the author's past observations, suggesting mild to moderate fever can be an early indicator of serious infection.
It's a tricky one, isn't it?
It is. It is.
I mean, fever is a natural response to infection, but it's not always present.
Right.
And sometimes it can be caused by other things. So it's not always a reliable indicator.
No. No, it isn't.
Yeah.
And this leads to the introduction of the Dr. Maya app, which is described as a tool to help individuals approach symptom assessments in a way that a junior doctor or family physician might.
Right. So it's about giving people the tools to think like a doctor,
Yes.
to understand the process of diagnosis.
Yeah. And it also underscores that very serious and pressing issue of, dwindling effective antibiotics due to the rise of antimicrobial resistance.
Yes, it does. And that's a huge problem.
It is. Yeah.
We're running out of options for treating infections, and
Yeah.
it's only going to get worse if we don't act now.
The book then provides, kind of concise descriptions of several common health issues, including allergies, gastroenteritis, hypertension, diabetes, and anxiety and depression.
Okay.
And for each one,
Mm-hmm.
it outlines, typical symptoms and general management strategies.
Right. So it's about giving people a basic understanding of these conditions
Yeah.
so that they can recognize the signs and symptoms and know what to do if they experience them.
Yeah, exactly. Interestingly, it also includes a brief mention of traditional remedies and natural supplements, acknowledging their potential role in supporting immunity and overall well-being.
Okay.
However, the primary focus of the book, as we've seen, remains on the principles and potential pitfalls of medical self-diagnosis
Right.
in the context of, conventional healthcare.
Yes, absolutely. It's important to remember that the book is not promoting alternative medicine
Right.
or discouraging people from seeking professional medical advice.
Right. It's about giving people the tools to make informed decisions about their health.
Exactly.
It's a recurring and really important message. Self-diagnosis is not a substitute
No.
for professional medical evaluation, especially when dealing with symptoms that are severe, persistent, or concerning.
Right. If you're experiencing any unusual or worrying symptoms, it's always best to err on the side of caution and see a doctor.
Yeah. Delaying proper treatment for serious conditions can have, really significant risks. However, The book does recognize the value of self-monitoring in tracking health metrics over time,
Yeah.
particularly for those managing long-term conditions.
Right. If you have a chronic condition like diabetes or high blood pressure,
Yeah.
it's important to keep track of your numbers
It is.
and to work with your doctor to manage your condition effectively.
Yeah. And the overarching recommendation is always to seek qualified medical help
Yes.
for any symptoms that are worrying
Right.
or don't resolve as expected.
Absolutely.
The book then delves into specific symptoms affecting different parts of the body, starting with the eyes.
Okay.
Blurred vision, eye pain, redness, discharge, and it emphasizes the importance of not dismissing these as, just trivial,
Right.
without seeking professional ophthalmological advice if needed.
Yeah, eye problems can be very serious.
They can.
So it's important to get them checked out if you're experiencing anything unusual.
Yeah, and it even provides a list of, potential underlying causes for each one.
Okay, so it's giving people some context.
Right. Yeah, yeah. It moves on to discuss common nose problems,
Uh-huh.
like allergies and sinus infections, and throat issues,
Right.
such as sore throat and tonsillitis.
Yeah.
The emphasis here is on identifying the underlying cause of these symptoms to ensure appropriate treatment.
Yeah, and that can be tricky sometimes, can't it?
It can. It can.
Because a lot of these conditions can have similar symptoms.
Right. And that's why it's important to see a doctor
Yeah,
so they can make the correct diagnosis.
exactly.
For tonsillitis specifically, the book highlights that it's often initially viral before potentially becoming bacterial,
Okay.
stressing the importance of a throat swab culture
Yeah.
before resorting to antibiotics.
Absolutely. Antibiotics only work against bacterial infections.
Right.
So it's important to make sure that you actually have a bacterial infection before you start taking them.
Yeah. And it cautions against, low-dose antibiotics that can contribute to resistance.
Right. And that's a big problem.
It is. It is.
We're overusing antibiotics, and it's leading to the development of resistant bacteria.
And then the section on coughs and breathing problems is particularly informative.
Okay.
It points out that a cough can be a symptom of many things beyond just a chest infection,
Right.
including allergies, asthma,
Yeah.
and even acid reflux. It describes different types of coughs: dry, productive, barking, whooping, wheezing, chesty,
Wow.
and the conditions they might be associated with. It also clarifies a common misconception,
Okay.
noting that pneumonia often presents with breathlessness and a grunting sound,
Oh, interesting.
not just a cough alone.
Okay.
There's a helpful guide on how to describe skin lesions,
Hmm.
differentiating between various types like flaky skin, which
Uh-huh.
could be eczema, psoriasis, or just dry skin.
Hmm.
Purpura, indicating bleeding under the skin.
Right.
Papules, small raised bumps.
Yeah.
Macules, flat discolored spots.
Okay.
And vesicles, small fluid-filled blisters.
Wow, that's a lot of different types of skin lesions.
It is.
I didn't realize there were so many.
The book also briefly explains the differences between bacterial, fungal, and viral infections, noting that symptoms can sometimes overlap,
Right.
and emphasizing the need for professional diagnosis
Yeah.
to determine the correct course of treatment.
Absolutely. It's not always easy to tell the difference between these types of infections just based on symptoms.
Right.
So you really do need a doctor to make the diagnosis.
Yeah. And then urinary problems, such as frequent urination, pain or discomfort, and discharge are discussed, with potential underlying causes,
Okay.
ranging from urinary tract infections and diabetes to prostate issues and sexually transmitted infections.
Right. And again, these are all things that need to be properly diagnosed and treated.
Absolutely.
Yeah.
The book returns to that growing concern of antimicrobial resistant infections, underscoring the significant risks they pose, including prolonged illness and increased mortality.
Yes. And that's a global problem.
It is.
It's not just limited to one country or one region.
Right.
It's something that we all need to be aware of and take steps to prevent.
Yeah.
Pain is highlighted as a critical warning signal that should not be ignored, urging individuals to consult a doctor if the source of pain is unclear, severe, or persistent.
Right. So don't just tough it out.
No, definitely not. Pain is your body's way of telling you that something's wrong.
It is.
So you need to listen to it.
Absolutely. Other red flag symptoms mentioned include sudden changes in bowel habits, persistent cough or breathlessness, and unexplained fevers.
Okay.
Severe abdominal pain is specifically identified as a potential medical emergency.
Right. And that's something that you should never ignore.
Absolutely no.
If you're experiencing severe abdominal pain, you need to get to the hospital right away.
Absolutely.
It could be a sign of a serious condition.
Yeah. Headaches are also addressed with a clear warning that severe headaches that don't respond to over-the-counter pain relievers require immediate medical attention.
Right. I mean, most headaches are nothing to worry about. But if you have a sudden severe headache or a headache that's accompanied by other symptoms like fever or stiff neck,
Yeah,
then it's important to get it checked out.
yeah. The book provides a concise list of those serious emergency symptoms
Okay.
that necessitate immediate medical care,
Mm.
including severe allergic reactions, anaphylaxis, fainting, significant injuries,
Mm.
and high fever accompanied by concerning symptoms like confusion, a stiff neck, or difficulty breathing. It also lists various conditions related to lumps in the breast, testicles, or swollen lymph nodes, rashes, sudden changes in vision or chemical injuries to the eyes,
Yeah.
acute joint or back problems, and certain genitourinary issues that may require urgent hospital evaluation and treatment.